That is not the case.
Most of them, I think 2 patients who did that. They stopped after the first month because they were already okay.
Yeah.
So they came back after 4 months because they had relapse.
Yeah, because you go through a certain period, no?
Yeah, for
remission, you call it a remission period. Yeah.
Yes, and it depends. No, the treatment protocol will matter depending on the sex of the patient. For girls, we give it for 2 years.
Okay.
For boys, we give it for 3 years.
And why is that?
Because the boys, they have the testicle. It it is like a sanctuary site for the leukemic cells.
Oh.
While us, we do not have the testicle.
Yeah, it's true.
Actually, there are 2 sanctuary sites for leukemic cells, the brain and the testicles. So that's why we give it longer for boys.
I see.
And girls have better prognosis than boys because of that also.
That's something to know. It's the first time that I know there's a difference whether you have leukemia if you're a guy or you're and for babies for that matter, because you know, if you have leukemia as a child, it can be very devastating in the parents.
Yes, and we have good prognosis also if the age is at 2 to 10 years old. But below 2 and above 10, the prognosis is not that good anymore.
So it's between 2
to 10.
So you have a very good chance
Yes.
of making it. What causes this disease?
Actually, one is possible genetic predisposition in the family. They have relatives with leukemia. Second is our surroundings, the food that we eat.
Also?
Yes, with preservatives around us, radiations, or the chemicals. Even when you inhale some gasoline.
Gasoline?
Yeah, especially the unleaded gasoline.
Yeah. Yeah, that's something that we take for granted. And some of us like to smell.
Yes, and the exhaust from the cars.
Yes.
And we tend to use more often now the sprays, the insecticides or the pesticides. Those are possible.
And our rice fields are filled with insecticides and pesticides.
If you live near the farm, you're prone also to it.
Oh.
And if it's due to these chemicals, usually they are the AML type, the acute myelocytic type, which is only 30% chance of cure.
Wow. So that's really very virulent type of
So we have to be very careful with the food that we eat, where we live, whether it's near the farm, whether they are spraying, and we should not just use it left and right, those sprays, the insecticide sprays or what have you.
And that's why the new technology now is to go into organic farming.
It's
true. It's true. So, Doctora, we're towards the end of our show, and we usually ask our guests to say something to our viewers for them to take note of what we have discussed for the episode. Something to do with the parents, telling them how to, you know, veer away from possibility of exposing their children to dengue.
Okay. For the mothers out there, I hope you will be very vigilant, be watchful, watch over your children, and try to prevent dengue infections in your children. So use anti-mosquito lotion if possible every day. Try to cover them, especially the legs and the arms. The dengue mosquitoes are low-flying mosquitoes, so they usually bite the leg parts, the lower extremities of your children. And try to check your surroundings also. If there are any standing water around, hope you will really be vigilant about this thing, because once your child will have dengue, we wouldn't be sure whether we will be able to save them from it or not. Because as doctors, we are just trying to help, trying to help hydrate them, trying to prevent them from shock. But there are some cases wherein we could no longer help. So I hope you will always be watchful.
Thank you very much, Doctora. So you see, now we know to be forewarned is to be forearmed. We know that there is no medication for dengue. And once you have dengue, you may have it again. And the second time and the third time you have it, you'll be more in danger of not recovering. So as I always say here, our health is our best investment. So stay healthwise.
Our next episode is strictly for adults only, an episode to remember. We discuss the often ignored, often overlooked topic of sex after 50. Does sex still happen at that age? Is sex still significant at 50, 60, or 70? We have invited once again our articulate and very current OB/GYN Dr. Mila Chan to enlighten us once more. But that's not all. We have a surprise guest. Oh no! So make sure you catch the next titillating episode of Healthwise. If you have any suggestions, questions, or comments, please write to us at healthwise36@yahoo.com.ph. We would like to thank Oscar Peralta for Mayan's hair and makeup, Coffee Bean and Tea Leaf at the Ayala Terraces for our venue, Pink Flora, and High Precision Diagnostics, making the world a better place for you.